Germany added 29,875 new coronavirus infections and 598 deaths in the 24 hours between Thursday to Friday, according to the country's disease control agency. For more on the situation there, we're joined by DW correspondent Emmanuelle Chaze. Thanks so much for joining us, Emmanuelle. Tell us firstly, the UK is first off the block in Europe to get the vaccine first. How come?
The UK is the first country in the Western world to roll out a vaccine, but Russia already began vaccinations with Sputnik 5 vaccine, their vaccine, and China also has a vaccine for its population. But this is the first time a vaccine that has gone through the late stage trials is being used. The British regulators approved the BioNTech Pfizer, which was developed here in Germany, shot on December the 2nd, and the UK received 800,000 doses of that vaccine, which allows to vaccinate 400,000 people. Now, there's a vaccination plan that sees people over 80, so the elderly being vaccinated first, in care homes first, in hospitals. They will be followed by nursing home workers and by vaccination staff.
All right, give us more details about how Germany plans to, roll out its vaccinations.
Well, the German Health Minister Jens Spahn said that 3 million doses of vaccines will be available in January. Now, why January? Well, it needs to be approved by EU regulators first. That should happen in the coming days, in the coming weeks. Chancellor Angela Merkel spoke about 70 million doses of the vaccine available during the first trimester of 2021. That's enough to vaccinate around 35 million people. In total, Germany, via bilateral agreements, via EU Commission, ordered 300 million doses of shots. They will be shared between BioNTech Pfizer shot and the Moderna vaccine, which had been developed in the US. This is enough to vaccinate its own population, but also to redistribute it to other countries. And here in Germany, we'll see two phases in the vaccination campaigns. There's 60 centers, vaccination centers that have been set up all over the country. First to be vaccinated will be the elderly, then hospital personnel. And once the vaccine production will have caught up and be more broadly available, then the general population will be able to be vaccinated.
Right, and the pandemic is far from being under control in Germany. How can you explain that? What measures are being taken by the government?
Well, since early November, we had a so-called light lockdown here, and this has failed to deliver good results. The virus is spreading more broadly, there's too many hotspots, and the vulnerable population is most affected this time around. I'm thinking about the elderly in particular. The figures are way too high, and today, Germany recorded its highest number of COVID-19 related deaths, 590, and more than 20,000 new infections. And on average, the 7 days incidence rate is 3 times higher than what it should be, with 150 cases per 100,000 inhabitants. There's more and more calls, both among the population and within the government, for a tougher lockdown. The worst affected regions, such as Bavaria, such as Saxony, have already implemented, tightened their measures. There's more restrictions that should follow. Berlin, for example, there's talk to implement more restrictions, but only after Christmas in the German capital. Now, time and again, Chancellor Merkel has said that we needed a tougher lockdown. She said we can't only rely on hope to tackle this pandemic, but most measures are up to the regions to implement.